So testing for depression. This is one of the biggest things if you look at what's Googled the most. This is something people want to know. How do you test for it? Because quite often people don't want the label of depression. They've gone to see a doctor, they've gone to see a psychologist, whoever, and they say, I think you're depressed. And they go, I am not. So they go home and they Google, how do you know if you're depressed? So this questionnaire is something a lot of doctors use. We quite often use it to check in. So there are lots of things. But then again, what we do differently is that we're trying to dig a little bit deeper. So we're going to ask for some blood tests. We're going to ask for some hormone tests. That might be blood. That might be saliva. There's a lot of different ways that we can really uncover what else is happening that could be contributing to these depressive symptoms. We want to rule out the thyroid disorders and the sleep disorders and the blood sugar disorders because like Whitney was talking about with that vitamin D patient, you correct such a simple thing and all of a sudden their whole world is different. And it can sometimes really be that simple. It isn't always that simple. Certainly when you're dealing more in the realm of stressors like a difficult job or a difficult family member, those solutions aren't always as cut and dry, and certainly when you're feeling depressed it can be a lot trickier to see the solutions. But if we can get some of this chemistry leveled out, the solutions may just show up so that you can find it a little bit easier to deal with things. So again, getting to that root problem of what's going on.